Multiple sclerosis, MS, is a complex and chronic autoimmune disease that primarily affects the central nervous system, CNS, which includes the brain and spinal cord. In MS, the body's immune system mistakenly attacks the myelin sheath, a protective covering that surrounds nerve fibers in the CNS, as well as the nerve fibers themselves. This immune-mediated attack leads to inflammation, demyelination, damage to the myelin sheath, and in some cases, damage to the nerve fibers themselves. As a result, the normal transmission of electrical impulses along the nerves is disrupted, leading to a wide array of neurological symptoms. The symptoms of MS can vary widely among individuals and can affect any part of the body. Common symptoms include fatigue, weakness, numbness or tingling in the limbs, difficulty walking, muscle stiffness or spasms, problems with coordination and balance, vision problems such as optic neuritis, bladder and bowel dysfunction, cognitive impairment, such as problems with memory or concentration, and mood changes such as depression or anxiety. MS is often categorized into different types based on the pattern of disease progression. Relapsing-Remitting MS/RRMS. This is the most common form of MS, characterized by episodes of symptom flare-ups, relapses or exacerbations, followed by periods of partial or complete recovery, remissions. Between relapses, individuals may experience periods of stability with minimal or no new symptoms. Secondary progressive MS, SPMS. Over time, many individuals with RRMS will transition to a secondary progressive phase, characterized by a steady worsening of symptoms and disability, with or without occasional relapses or remissions. Primary progressive MS, PPMS. In this less common form of MS, symptoms progressively worsen from the onset of the disease, without distinct relapses or remissions. Progressive relapsing MS, PRMS. This is the least common form of MS, characterized by a steady progression of symptoms with occasional relapses and partial recoveries. The exact cause of MS is not fully understood, but it is believed to involve a combination of genetic, environmental, and immunological factors. Risk factors for developing MS include having a family history of the disease, being female, having certain viral infections such as Epstein-Barr virus, smoking, and living in regions farther from the equator. There is currently no cure for MS, but there are treatments available to help manage symptoms, slow the progression of the disease, and improve quality of life for those affected. Treatment may include disease-modifying therapies, DMTs, to reduce inflammation and modify the immune response, as well as medications and therapies to manage specific symptoms. Additionally, lifestyle modifications such as regular exercise, stress management, and a healthy diet may also play a role in managing MS symptoms and promoting overall well-being. Ongoing research continues to improve our understanding of MS and develop new treatments to better manage the disease.